Hi everyone, this is Dr. Saiti, Team MDSCONQUER. Now let's continue with the pharmacology quick revision part 2. So I'm going to first discuss the anti-diabetic drugs. So already you must have gone through all these videos, but just is going to be a quick revision. Okay, so what are the alpha glucosidase inhibitors? Those drugs which come under alpha glucosidase inhibitors are the acarbose, migitol and voglibose, and the side effect is a flatulence, diarrhea and less absorption of the drugs, and it's contraindicated in the renal failure. Okay, next the GLP-1 agonist. So all the tides come under that, and the drug of choice for obesity is a liraglutide. Okay, and its side effect is nausea and vomiting, and it causes weight loss. So that's the reason it can be given as a drug of choice. Okay, and also one of the other side effect is a pancreatitis, and it's contraindicated in the renal failure again. So next the DPP-4 inhibitors, where the gliptins come under that. So here the lingagliptin can be given in the chronic renal failure, and vindagliptin causes hepatitis, and the saxagliptin has a risk of heart failure, and this can be given orally, and there is no nausea, vomiting or weight loss, and they can cause infections and pancreatitis as well. Next, amylin analogs, pramlintide, where you can see the type 1 and type 2 diabetes, it can be given, and it is under trial for obesity. Okay, remember the drug of choice is a liraglutide, but the trial for obesity you have to go for pramlintide. Okay, and this can be given as a subcutaneous route, and again it has weight loss and nausea and vomiting. So these is the main area to be emphasized. Okay, so the types of insulin and the names, what are the rapid, what is the short, what is intermediate and what is long, and the onset of action and the duration of action, so quite important. And the insulin which can be given IV is a crystalline zinc. Okay, so this is regarding the insulin, and very important table related to that. So next the intermediate acting, so just have a look, that is isophane and the lenti. So what is the composition of lenti again can be asked. Then the insulin, so most commonly it is given as subcutaneous site is abdomen, followed by anterethra and upper arm, and regular insulin can be given as IV in diabetic ketoacidosis. So if there is a complication of diabetes, and if immediately it has to be treated, then you can give the regular insulin as IV. Okay, then inhalational powder is the Afrezza. Again, it's a very important point, Afrezza, which is an inhalational powder. Side effects, so it is lipoglycemia, lipodystrophy, lipohypertrophy, all these are the side effects of the insulin. Next, the antihyperglycemic drugs. So this, the classification, note it down. So quite important, what are the sulfonylureas, what are the meglitinides, first and second generation, what are the biguanides. So most commonly drug given is the metformin, right? So what all comes under the antihyperglycemic agents, do have a look. So sulfonylureas, so they release more insulin for a longer period of time. Okay, they cause a maximum decrease in the HbA1c, and they are metabolized in the liver and excreted by the kidney. Okay, so here they can cause weight gain and hypoglycemia. So these are the drugs which can cause weight gain. Okay, next the first generation, which includes acetohexamide, torbutamide and chloropropamide, and second generation glibenclamide, glycoside and the glibizide. Okay, so what are the important points related to here? These specific drugs are clearly given here, to have a look of it. Okay, next the meglitinides, so this can be used only with dose adjustment in renal failure. Okay, so they can be given with little dose adjustment. Next, thiazolidinediones, so these are the important points related to that. Okay, so they can decrease the insulin resistance, they increase the transcription factor, they increase the adipose proliferation and increase the GLUT4 production. So all these are the important points related to it. And the side effects, again the macular edema, sodium and water retention and bone fracture in females. Biguanides, they decrease the hepatic glucose production, and they can be used both for treatment as well as prophylaxis for the pre-diabetic patients and the PCOS and non-alcoholic fatty liver disease. These are the two drugs which come under that. Okay, so side effects, the weight loss, the nausea, vomiting, lactic acidosis, and the absolute contraindications are clearly given here, note them out. Okay, next SGL2 inhibitors are these drugs. Okay, and these are not given as monotherapy, they are given in combination with the others. Okay, So next, effect of anti-diabetic drugs on weight. So if you see those drugs which increase the weight and those drugs which decrease the weight, so it's clearly given here. Have a look. So these are the summary of all the anti-diabetic drugs. So just you can have an idea. So first thing is the classification and the important points related to each and every drug. Do note it down. Okay, that's with the anti-diabetic. Now comes the antithyroid. So here it's clearly given, so where the iodides act. Okay, so it's important for you to have an idea of this particular chart. So what are the sodium and the iodine synthetase inhibitors? At these drugs, that's thiocyanate, percolate and the fluborate. Okay, so next, what are the thyroid peroxidase inhibitors? These are the propyl thyrouracil, and it is short acting and but it is hepatotoxic, but it is a drug of choice in pregnancy for hyperthyroidism, whereas carbamazole, being teratogenic, it cannot be given in pregnancy, but it is a drug of choice for hyperthyroidism, but in pregnancy you have to give propyl thyrouracil. Okay, next side effects: agranulocytosis, GI upset and allergic dermatitis. Next, thioendopeptidase inhibitors. These two, they are fastest acting, they decrease the vasculogenesis and reduce the size of the thyroid. Side effects are not that important. Next, 5-deiodinase inhibitors. So propyl thyrouracil has multiple mechanisms of action, so even it can inhibit 5-deiodinase, and besides that, beta blocker steroids and amiodarone. Next, iodine 131, again, okay, for hyperthyroidism, for Graves and thyroid cancer. So it's important related to iodine 131. Okay, absolute contraindications and all are quite important for each and every drug. Next, hypothyroidism, the levothyroxine and leothyronin. So this levothyroxine can be used for replacement, whereas leothyronin not for replacement. Okay, so this is regarding the antithyroid drugs. Now comes the anticoagulants. So these are the broad classification: direct thrombin, 10A inhibitors, indirect thrombin inhibitors and vitamin K inhibitors. So direct thrombin, so that is these drugs which are clearly given here, which are orally and parentally. Parentally, lepirudin, desirudin are the drugs that are given. So they can be given in DVT and prophylaxis for thrombosis. They can be given. Okay, and this drug causes hepatotoxicity. Okay, next, 10A inhibitors, and antidotes are again quite important. So if you see, this is the antidote for dabigatran. Okay, next, 10 inhibitors, you have 10A in that, so the name has 10A if you see. Okay, so these drugs do not require monitoring. Okay, so they don't require monitoring. This is important point. Next, indirect thrombin inhibitors, that is unfractionated heparin, LMH, WH and fondapavrinex. So the mechanism of action, it's pretty clear. So unfractionated heparin both on 10A and on thrombin, whereas the low molecular weight heparin, okay, so it predominantly, much predominantly on factor 10A. Okay, so this is how the difference between unfractionated, low molecular weight and ultra low molecular weight, or the fondapavrinex difference, how it looks. So just have a look. Next, unfractionated heparin, so it can be given as subcutaneous for prophylaxis but less bioavailability, but IV it can be used for treatment for as QID. Okay, short acting, safe in renal failure, and antidotes are quite important. Okay, so protamine sulfate is an antidote. Okay, side effect is again heparin induced thrombocytopenia. So whenever the patient is having heparin induced thrombocytopenia, you can treat with direct thrombin inhibitors or fondapavrinex. So low molecular weight heparin and fondapavrinex, so just the difference is, so this is the longer acting and that is the longest acting. Okay, so here there is less effect of antidote and here there is no effect of antidote, and there is less heparin induced thrombocytopenia, here there is no HIT. Okay, so this is the main differences. The uses, okay, so uses: unfractionated for catheter induced thrombosis and concurrent anticoagulant with thrombolysis, whereas low molecular weight heparin for MI, for DVT, embolisms, unstable angina. Okay, so all that. And side effects is HOTA, that is hemorrhage, osteoporosis, thrombocytopenia, alopecia, and contraindications is HER capped, that is HIT, endocarditis, renal failure, except unfractionated heparin, cirrhosis, alcoholics, peptic ulcer and thrombocytopenia. So all these are the important points. Next, Warfarin, which is a vitamin K inhibitor. Okay, so dependent factors 2, 7, 9 and 10. And next, uses for DVT prophylaxis and treatment, for thrombosis prophylaxis and antiphospholipid antibody syndrome. Okay, side effects, obviously all these anticoagulants main side effect is bleeding, so it worsens the HIT, alopecia, blues, discoloration of feet, skin necrosis, and it's again teratogenic because it causes nasal hypoplasia and it crosses the blood-brain barrier. Okay, so this is the side effects. Okay, with this we are done with the anticoagulants. Now comes the antiepileptics. So calcium and potassium channel blockers, calcium and sodium channel blockers are for the generalized tonic-clonic seizures. Okay, so myoclonic seizures for calcium and sodium channel blockers except carbamazepine and phenytoin. Okay, whereas absent seizures the calcium channel blockers. Okay, so already we have discussed why that is being given in generalized or partial seizures. There is a concept behind that. So if you missed or if you want to have a look, you can go back and just give a look to that. Okay, next the partial seizures, sodium channel blockers, carbamazepine. So calcium channel blockers are the valproate and ethoxysuccinate. So drug of choice for GTCS, absent seizures and all that. Okay, even for prophylaxis of migraine, but being the last option. Side effects, just the normal side effects. So it is hepatotoxic pancreatitis, can cause tremors and hyperammonia. And sodium channel blockers, these are the list of the sodium channel blockers. And the phenytoin, the usages, okay, and it follows zero order kinetics. The phenytoin side effects, so hydantoin itself is a other name and that's again the side effect. So hypoplasia of gums, I think you know it. So lymphadenopathy, diplopia, ataxia, nystagmus, teratogenic and osteomalacia, inducer of enzymes and neutropenia. So all these are the side effects. Carbamazepine, the bipolar disorders, the generalized tonic-clonic seizures, acute mania. So side effects is heads. Okay, that is hyponatremia, hypersensitivity, eosinophilic granulocytosis, diplopia, aplastic anemia, ataxia, Stevenson-Johnson syndrome, splenomegaly. So all these are the side effects. Lamotrigan, so it blocks both sodium and calcium channels and relatively safe in pregnancy. Okay, so it is starting at a low dose and it is never to be given in emergency. Okay, topiramate, these are the important points, so just have a look of it. Okay, next the potassium channel openers. Okay, so this is a drug that is ezogabine. Okay, side effects include the retinal deposits and pigmentation and decreased glutamate effect. Okay, so these are the important drugs that is given, the felbamate. Okay, and other drugs like APMA antagonists, that is the drugs that is telampanel and all that. So just give a glance to it. Next, the increase the GABA, pregabalin and gabapentin, inhibit the reuptake by a tiagabine and inhibit the GABA transaminase is a vigabatrin. Okay, so these are the nothing but the antiepileptics. Next comes the opioids. So mu, kappa and delta receptors and the effects. So we have already discussed this before. Okay, so with mu, meiosis, urine retention, sedation, constipation, analgesia, respiratory depression, negate the bile flow and euphoria. Kappa is for constipation, analgesic and dysphoria. Okay, so euphoria is with mu and kappa is for dysphoria. Right, so what are the pure agonists? Morphine, codeine, tramadol, methadone and loperamide. Okay, so morphine being the important alkaloid of opium, soluble in water, so uses for severe pain like labor pain, bone pain, MI pain. Okay, it's an antitussive as well, and side effect is it increases the intracranial pressure, so avoid in head trauma. Underline, increases the histamine, so it can cause bronchoconstriction, and pinpoint pupil, so which is a diagnostic for the opioid poisoning. So very important side effects related to morphine, do underline them. Codeine, this is naturally pure agonist, less potent, less adverse effects. It is also given as an analgesic, antitussive and antidiarrheal. Tramadol, so analgesic action by inhibiting the non-adrenaline and serotonin uptake. And methadone and other point, yeah, it doesn't, other drugs like the loperamide doesn't cross the blood-brain barrier and it's given in non-secretory diarrhea. Okay, whereas diphenoxylate crosses the blood-brain barrier. Next, methadone, it blocks the NMDA receptors, prevent the withdrawal symptoms, maintenance of drug in opioid dependence. Pethidine, so the important points, it can be given in post-op pain, labor pain, and drug of choice for chills after anesthesia. So that is an important point again. So next, heroin, it has the withdrawal symptoms and it's converted to morphine in the body. The signs of being high heroin, it's clearly given here. Note them out: the watery eyes, the small pupils, runny nose, itchy skin, and all that. Next, fentanyl, it is synthetic. Okay, it's 100 times more potent than morphine, and sufentanil is 1000 times more potent. So which is the following is the most potent, then you have to go for sufentanil. Okay, so mixed are these drugs: the pentosacane, diazokine, nalbuphine, okay, butarphenol, and buprenorphine. Okay, buprenorphine. Okay, so these are the antagonists. So naloxone, nalframine, and naltrexone. So where all they are used and what is the side effects? Side effects for hypertension, cardiac arrhythmia. They are used for opioid toxicity. Okay, so these are used for maintenance of opioid poisoning. So what is for toxicity? What is for maintenance? You have to have an idea. So note the important points. Next, antagonist, peripheral are these. Okay, where they can be used for the opioid induced constipation. Next, coming the diuretics. So the first group of drugs which come under diuretics are the carbonic anhydrase inhibitors. Most potent is acetazolamide. Okay, and it can be used for glaucoma, for motion sickness, for catamenial epilepsy, right? So all these are the uses, right? And these are the important points related to it. Okay, so it causes metabolic acidosis, so that's the reason it can be used to treat alkalosis. Okay, so minimum loss of water, so it's not a very good diuretic, and it blocks the excretion of ammonium, so it's contraindicated in liver failure. It decreases the aqueous humor production, so that's the reason used in glaucoma. Okay, so very important points related to the acetazolamide. Next, loop diuretics. So loop loses calcium, very important point. Furosemide is a common drug which is used. Okay, and ethylcyanic acid is ototoxic, very important. Most potent is bumetanide. So these are the again important points related to it. So it causes hypercalciuria and nephrolithiasis, it causes hypomagnesemia, it causes metabolic alkalosis. They are weak CA inhibitors as well except bumetanide. Okay, and there is maximum loss of water and solute. Okay, so they are the drug of choice in emergency like pulmonary or cerebral edema. Next, osmotic diuretics, the mannitol is the example for that, and the side effects: pulmonary edema, renal like dehydration, hyponatremia, and hyperkalemia. Okay, so contraindicated in pulmonary edema, acute renal failure, and active cerebral bleeding. Thiazides, that's chlorothiazide, hydrochlorothiazide, indapamide. So all these are the important points again related to that. Note it out. Okay, so these are the important points again. Okay, so what are all the mechanisms of actions related to the thiazides are clearly given here. Note them out. Next, the aldosterone antagonist, so spironolactone. Many times they have asked what's the exact mechanism of action of it. So uses resistant edema, hypertension, and it decreases the mortality in MI and congestive heart failure. Okay, so NAC inhibitors includes the dimetrin and amiloride. Okay, so all these is already you have come across in your regular discussion, right? So you can just open your notes while going through this. Okay, so it will be like a easy revision for you. So this, in a summary, all the important points are again given here related to diuretics, so just have a look. Okay, so with this, the part 2 of your pharmacology is done. So I made it very quick for you. What I suggest is, so for a glance, just listen to what I am saying and put your notes in front of you. Okay, I already told you, you need notes for pharma. It is like mandatory, right? So for pharmacology, if you have your notes, so while going through this class or this entire quick revision, it will be like a very quick. So it is half an hour, not more than 1 hour. You will be done with your important system wise in your pharma. Okay, so just give a glance, that's enough. Thank you.